Pacemaker is an instrument, is a fantastic instrument created for the sake of maintaining the heart rate. The pacemakers are the ones which maintain the normal heart rate for the patients, and it is put in patients who have features of complete heart block, that is, heart rate is slowed down too much, and such patients we use the pacemakers. And there are different types of pacemakers like single chamber pacemaker, double chamber pacemaker, and a triple chamber pacemaker. And commonly used are a single and a double chamber pacemakers. And this awareness should be there for the people. It is simple words, it is like an inverter in the house. When the current goes, the inverter will switch on. Like that, when the heart rate comes down, immediately the pacemaker will switch on and it will start maintaining the prescribed heart rate. So that is the role of the pacemaker. And generally the pacemakers are put in the below the skin, below the clavicle, on the either the left or the right side of the chest, and it is put below the skin. So it is done under local anesthesia, and people need not be afraid of the procedure because it is done under local and it is below the skin, so that the pacemaker is not exposed to the atmosphere. And what is the observer? Generally, we keep the patient after pacemaker insertion 1 day in the CCO to see that he doesn't move. 24 hours of absolute rest is given, and the pacemaker, the leads are nicely fixed in the heart, and his limbs are supports are given so that he doesn't move the arm above the level of the shoulders. So this is kept for 1 day. The next day patient is mobilized in the CCO and he is shifted back to the rooms, corresponding rooms, and then there he can walk around, and 1 day he is kept there to observe that any changes, and if everything is okay, he is discharged. Subsequently, the advice at the time of discharge is that they should avoid going under the high tension wires and going near the micro oven where there is a microwaves are manipulated. So they should avoid going near the micro oven and lifting the arm above the level of the shoulder for at least a week or 10 days. So with this advice, the person is discharged and he can start going to his work or walking, like other activities he can carry on without any restriction.